Ultrasound is an effective, non-invasive imaging modality that can be used to assess the heart for a number of cardiovascular disease processes. The term cardiac windows refers to areas on the anterior chest wall through which the ultrasound beam can effectively reach the heart without being blocked. These windows include, but are not limited to, the suprasternal, parasternal, apical, and subcostal windows. There is no specific preparation needed for transthoracic echocardiography. The patient does not need to fast for this exam. Ideally, the patient should lie in the left lateral decubitus position when parasternal and apical images are being obtained. However, the patient can be scanned in the supine position if the patient is unable to roll over. Attach a probe suitable for cardiac imaging to the ultrasound device. It should have a small footprint, a sector display format, and a frequency range of 1.5 to 3.6 MHz. Select the cardiac preset on the ultrasound device. Locate the probe orientation marker. The probe orientation marker corresponds with this image orientation marker on the ultrasound display. During cardiac imaging, this image orientation marker should be located to the right of the image. During all other ultrasound applications, this marker will be located to the left of the image by default. The gain, focus, depth, and TGC should be adjusted so that the desired structures are brought into view in the highest quality possible. The parasternal views typically require a shallower depth setting of approximately 12 to 16 centimeters, while the apical and subcostal views require a deeper setting of 16 to 22 centimeters. The parasternal window is commonly the starting point for obtaining views of the heart. Start scanning in the left parasternal region, just lateral to the sternum from the 2nd to the 5th intercostal spaces. The goal is to align the transducer beam with the long axis of the heart. The probe marker should be oriented toward the patient's right shoulder. While scanning, the image can be improved by slight rotation and tilt of the probe. In the parasternal long axis view, the following structures should be clearly visualized in the image: the left ventricle, left atrium, root of the aorta and proximal segment of the ascending aorta, right ventricular outflow tract and right ventricle, aortic valve, mitral valve, interventricular septum, posterior wall of the left ventricle, and the pericardium. The depth should be set so that the posterior wall of the left ventricle and the pericardium are included in the image.